What is this? Fredbear, Spring Bonnie, and is that Billy the puppet I see? Today we're back at it, breaking down and reacting to all of the nightmarish medical scenes and insane injuries from Five Nights at Freddy's. Let's dive right in. Oh gosh. Putting your head inside somebody else's mouth is probably not the best idea. Dental injuries, bite wounds, something that I do see in the emergency department. We see people come in with human bites, so somebody else biting you. Sometimes it breaks the skin. You worry about the different bacteria that can actually get embedded in. With puncture wounds, you worry about the bacteria getting seeded down. So if you actually suture it closed, you're actually sewing in the bacteria.
No!
Oh.
No!
What is going on?
What is happening?
Crush injury to the face. Crush injuries that we end up seeing are typically due to falls, bats, or hammers, or crowbars. And then obviously car accidents are a big one. A lot of times those will end up at a trauma center. Oh my gosh, okay, so electrocutions, they do occur commonly. The energies and the electricities are usually low. It can cause muscle contraction. If you're having full body, high energy injuries, then it can cause cardiovascular events. It can cause asystole, where your heart just stops. You're always worried about the burning of the nerves, burning of the tissue. If there's too much tissue damage, what ends up happening is the breakdown of those cells. The byproducts of it end up going through your kidneys to be filtered out and actually can cause kidney failure. What is this?
What?
Hook as a hand and impale somebody in the head with it. It is probably not super sharp, but it's pointy enough that it can cause a penetrating trauma through the skull. Now it's hitting on the left side. If it doesn't go all the way through, you always worry about an epidural hematoma caused by an injury to the middle meningeal artery. Then you can also hit that parietal part of your brain, which ends up being a lot of important structures where motor function is, where sensory is. Basically choking this individual. It's cutting off airway as well as potentially decreasing blood flow in and out of the head.
Blood just drained from his face.
You can crush somebody's windpipe, trachea, and cause inflammation to where you can't get any air through the area. You can compress it down, which is difficult to do. And then the other component is the major blood vessels that are running along each side of your neck. Crush injuries by other people's hands. Obviously, it's not likely. Could it potentially happen? Obviously, there's always exceptions to the rule, but you wouldn't necessarily find yourself in a common situation where that would occur. Whoa. Facial traumas, facial injuries, they do bleed a lot. The face is so vascular, which in itself is actually a benefit, because if there's any potential of wounds, the likelihood of them getting infected is pretty darn low, and they heal really well. Same with the tissue of the face, that heals really well because of so much blood supply to that area. Oh my gosh. And then obviously, if there is a lot of bleeding, we need to clean it up as much as possible, find where the bleeder is coming from, and try to get it to stop. First, always try to use compression, so push pressure on the area, hold it
now
for a little while, see if it actually self-heals, and if it doesn't, then we actually have different types of suturing techniques. This gurgling noise that we all believe to be basically somebody's neck is cut. We typically don't hear that very often in the emergency department. It's not super common to have somebody's neck lacerated and coming to the emergency department. But typically, if that is the case, you want to secure airway first. So if the airway is cut all the way through,
slit his throat from ear to ear.
you have the opportunity to either put a tube near where the cut is or through the cut if the trachea is accessible. Oh, that's a lot of sharp teeth in there, okay? All I could see is like puncture wounds, injuries. It almost is similar to like somebody getting bit by a shark, because there's multiple layers of teeth there. A ripping, brutal type injury where it's not a smooth cut. So the tissue is very hard to put back together. A lot of times when somebody has really rough edged wounds, we actually have to cut some of the tissue away to be able to make smoother edges so we can actually bring the tissue together. Otherwise, it won't heal right. Is a trick.
That's bait.
What are we doing here? Oh, come on. I saw that coming a mile away. Facial traumas by potentially a bite. So you could actually have a lot of bleeding again. It's just like a superficial flesh wound.
Just a flesh wound.
You won't necessarily bleed out unless there's a neck injury. You do have some major blood vessels of the face that are basically branches off of the external carotid arteries. One goes deep inside and the other one goes superficial. Oh my gosh. Oh. Come on.
Come on!
Single knife wound injuries. We do see a lot of them depending on where somebody is injured. Depends on how we approach it. So if it's into the chest cavity, always worry about bleeding on top of a punctured lung or any major structures underneath that. Versus arms or legs, and you just worry typically about any major blood vessel, and then it's mostly a superficial wound. Anything into the abdomen itself, you're worried about organ punctures. So a lot of times you'll get a CT scan and then possibly just go to the OR immediately, especially if it is very deep. And then obviously within the thoracic cavity, you also have your heart. The big thing is if the heart is punctured, you will potentially die quickly. Oh. Oh, blunt head trauma. Solid object to the skull itself. Your bone is the thickest in the front, but it also have sinuses here, so you can actually have a fracture of part of the sinus because it's basically a pocket of air, so there's a bone on either side. If there's a fracture all the way through, especially in the sinuses, you always worry about potentially a cribriform plate injury, which basically connects the brain to the face itself and the nose, so there's always an increased risk of infection there. If it's not a massively displaced skull fracture, most of the time they'll heal on their own, but you definitely need close observation. Oh, so it goes inside the suit. Okay. Oh! The spring locks basically malfunctioned, releasing in all different directions, causing it to impale, crush, and almost look like ripped tissue. So you could potentially have all of these massive injuries. And then the question ends up being, does it cause you to die from injuries super fast? It just depends on what organs have been hit. The brain was injured, spinal cord severed, if the heart was impaled, those sorts of things. The obvious things. If you lose 40 to 50% of your blood volume in a very short period of time, that's not necessarily sustainable with life. That's hypovolemic shock due to trauma, to where you're level 4 on the trauma criteria and you're basically going to die quickly. You're going to have end organ damage, you're going to have renal failure, you're not going to have enough blood to perfuse your organs, which gives the oxygen to your tissues and to the organs, and they're not going to be able to function. Other situations where we see crush injuries outside of like car accidents would be at like factories, seeing people get crushed by big machines, maybe not paying attention or getting caught, and you can get crush injuries, you can get amputations due to that. But again, usually these are limbs, they're not full body, they're not basically surrounded by something that's going to crush them. Maybe if somebody was wearing like the Iron Man suit, that potentially could malfunction and cause injuries. If you guys enjoyed this, definitely check out this playlist right here. And if you want to see more, let me know in the comments. And obviously make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.